Hello, students. Today we are going to know a lot of things regarding health and its importance. All must have heard about the proverb, health is wealth. Now, I am going to tell you a small story where you can really understand the importance of health. Once there lived two men who had a different taste for life but shared a relationship of friendship. A high paying job embraced Sachin, and Ravi had to go as a laborer. Eventually, both got married and had children. Sachin loved his family by providing and living a luxurious life. Ravi's love for his family was earned through hard work and simple living mechanism. Money led Sachin into a vicious circle of unhealthy habits like improper diet, drug abuse, smoking, luxurious lifestyle comforts. So earning money was so easy for him that he never exercised much, whereas Ravi had to sweat out every day to earn meager income. His income enabled a balanced diet for him and his family. Just like that, both of them crossed paths one day. They were glad to see each other. They talked and laughed at length when they remembered their childhood memories and their lives so far. Yet one truth left both of them on a sad note. The truth was Sachin had a kidney failure and his chances of living were minimal, which was a result of his unhealthy lifestyle. His money could not buy a kidney donor. A certain realization set in Sachin's mind and he asked himself, why did I fall ill? And his life flashed before him. His wealth could not save his health. Eventually, his fortune consumed him. So, students, you must have learned how health is important for your life. Only if you have a very good income, that doesn't mean you lead a very comfortable life. Well, comfort does not mean you live the other aspects of life. You have to take care of your health, individual health as well as public health. So let's move to today's chapter, that is, why do we fall ill? So here in this chapter we will be going to learn number of things, like you will remember the names of different disease causing agents, and you will be able to differentiate acute and chronic diseases, understand the importance of community health. You will be able to analyze the various causes of a disease. Also, you can evaluate the mode of action of antibiotics, and also you can justify that it is very difficult to make antiviral drugs than antibacterial drugs. So let's move to the chapter health and disease. They are the two parts or the two sides of a coin. And first, cell is the unit of life. It is a dynamic place where different metabolic activities are interconnected. The function of heart, lungs, kidney, etc. are coordinated. And for metabolic activities, you need energy. Who is providing the energy? It is food that you take. So it is essential that you should take proper food for proper functioning of your cells and tissues. So how could we define health, or what is the meaning of health? According to World Health Organization, health is a state of being well enough to function well physically, mentally and socially. That means health is not simply absence of a disease. It means you have to be sound physically, mentally as well as socially. So it covers all the three aspects of health: mental health, social health and your physical health. So good health depends on our efforts and also on the environment to which we are exposed to. Our social environment is an important factor in individual health. We live in villages, towns or cities. Here, our physical environment is decided by our social environment. We need to be happy in order to be truly healthy. Good health demands sound mental health, that is, free from anxiety, fear, stress, depression. And when you say social equality and harmony, then they are also playing significant roles. Physically also, sound health means one should be free from diseases. Individual health includes care at individual level, you have to take care of your own body, such as brushing your teeth regularly in the morning as well as at night before going to bed, combing your hair, washing clothes, bathing, cleaning. And another very important aspect is timely vaccination. So, along with individual health, there is also community health or public health. So, it includes collection and disposal of garbage, cleaning of drains, not allowing water to stagnate on streets and open spaces. There should be provision for supply of clean drinking water. Then there should be sweeping or cleaning of roads by the municipality scavengers and mass immunization programs and also awareness drives. So, you see, public health and individual health. But what to conclude? Public health is important for individual health. So, we can bring the public health or the community health by efforts of group. It is group effort. So, individually, we have to take care of our own health, plus at the same time we have to take care of community health, because if your community or environment is not clean, how you can be clean, how you can be safe? So, we have to follow the 5 F's. So, what are those 5 F's? Let me tell you. Let me show you here. I have made this one. See, the 5 F's, that is for prevention of transmission of diseases by maintaining sanitation and hygiene. The first one is fingers. Here you have to wash your fingers before eating food, before preparing food, and also after defecation. Then the next one is field. So from the field we are getting fruits, vegetables, etc., and all those should be properly washed before putting it for cooking. And then the third F, all of you see, flies. So your food should be properly covered and you should control the entry of flies, otherwise you will be infected. Then the number 4F is food. So here all the food items which you are using, that has to be cleaned properly before consuming it. And the last one is fluid. So here fluid means proper drainage system. That means your drains should be cleaned at intervals and it should be properly maintained time to time, so that the infecting agents will not cause any pollution. So these are the 5 F's which you have to maintain in order to prevent the transmission of diseases by sanitation and hygiene. So students, it is very important for you and for every person that you have to follow this in your life, daily life. Now, you should know the distinction or the difference between healthy and disease free. Simply not being diseased is not the same as being healthy. Good health for a dancer means to be able to stretch body into different but graceful postures. It differs for a singer, actor, for a sports person, for a laborer, for a office going person. There are different meanings of good health for these persons, right? So health can be used in a broad sense like society, community, whereas when you are using the term disease, it is linked to particular individuals or individual sufferers. Now, we'll study about the causes of different diseases. Okay, so how do we know that there is something wrong in the body? Got it? You see, there are some symptoms. What are symptoms? They are the things which we feel as being wrong. Means something we feel uncomfortable, something that deviates from the normal, right? So that can be called as symptom. For example, headache, stomach pain, loose motion, or wound with pus. These are all symptoms. So symptoms definitely they indicate that there might be some disease, but they don't indicate what the disease is. So next is, when you go to a doctor or a physician, he will be asking you the symptoms, and then the doctor or the physician, he will search from the symptoms or on the basis of symptoms, the doctor will look for the signs of a disease. Okay, signs, S-I-G-N-S, signs of a disease. So those signs of a disease definitely will give a little more definite indication of the presence of a particular disease. After that, the physician may advise for lab tests or diagnostic tests to pinpoint the disease further. So now we can divide the diseases broadly into different categories. First category is on the basis of the time period for which it lasts. So we can divide the groups, two groups. One is acute diseases and the second one is chronic diseases. So all of you know acute diseases means these diseases they last for a short period of time and we get recovery from the disease and it has no major impact, means negative effect on our body, right? But when you talk about chronic diseases, they last for a long period of time and they definitely have some effect on our organs and organ systems and they may even last for your lifetime. Suppose acute disease, viral fever, typhoid, we get recovery, no? But acute like filariasis or there is high blood pressure, diabetes, these are all chronic. Usually the person suffers throughout the life and he has to take all the precautions to get rid of those diseases, right? So we should be very careful about the non-occurrence of chronic diseases. Then another category of classification is we can divide into infectious and non-infectious. Based on what? Based on which is the causing agent, whether any infecting microbes are involved or not, right? So if infecting microbes are involved, then the disease is coming under infectious disease. So, and those diseases which are caused by some genetic defects or by some malnutrition, means you are not getting proper vitamins and minerals, right, or because of the effect of the environment, then those are the non-infectious diseases. So infectious diseases, suppose you are having fungal infection, some allergy or skin rashes are there, that is an infectious disease. Chicken pox, that is also infectious. Then non-infectious, you can take the example of any malnutrition disease like night blindness, then beriberi. Similarly, genetic defects like Down syndrome, Turner syndrome, these are all non-infectious diseases. Now, when there is a disease, we always discuss about what could be the possible cause of a disease. This, that we will discuss or not. Suppose, let us take an example of a baby. Small baby is having loose motion. So, first thing which comes to our mind is maybe because of unsafe drinking water. Then the infecting agent is there in the unsafe drinking water. Then the question comes, if one baby is suffering, why not other babies in the locality, why they are not suffering? Then the question comes, that baby is having, I think that baby must be having low means resistance, less resistance. So why there is less resistance? That means maybe because of malnutrition, means not given proper balanced diet. Okay. Then the third reason may be some weak immune system. Okay. So we are having number of causes for that. But if the pathogen is not there, the disease simply cannot occur, even if there are other causes like the genetic factor or malnutrition, right? So one cause, the principal cause is the immediate cause, right? But the other factors, the other causes are called the contributory causes. Hence, diseases have different causes. First category is immediate causes and the second category is the contributory causes. Now, we will study the different infecting agents or the infectious agents. So, there are different categories. Virus, okay, first virus, then bacteria, fungi, protozoa and worms, right. Worms, you see, they are multicellular and they multiply a little bit slow rate compared to the other four groups of microbes or the infectious agents. So, the different infecting agents we will discuss now. So, let me show you the pictures of the agents, the infectious agents. See. So, here one is this virus, SARS virus, which causes SCID, severe combined immunodeficiency disease. And here you see Leishmania donovani. This one causes a disease, severe disease, serious disease, that's called Kala-Azar. Then, so here you see Staphylococcus, this is bacteria, another disease causing agent. So it causes the disease called acne, or you are having pimples during adolescence. Usually pimples come out on your faces, so that is caused by this microbe, that is Staphylococcus bacteria. Then here you see Trypanosoma, this causes sleeping sickness disease. And here another one, Ascaris lumbricoides, this is the ringworm, or this is called the roundworm. The common name is roundworm. So Ascaris lumbricoides, here this is male Ascaris and female Ascaris. So all of you see the female Ascaris and male Ascaris, there is some difference. In the male Ascaris the anal part is little bit coiled. So which disease is caused by this one? It causes ascariasis. So some examples of viral diseases like common cold, influenza, dengue, AIDS, cancer. Then bacterial diseases like typhoid. So when you say typhoid is caused by a bacteria called Salmonella typhi. So it is because of intake of contaminated water or contaminated food. Cholera, anthrax, tuberculosis, these all of you know are bacterial diseases. So here in the picture you can see the diagram of AIDS virus and that of SARS virus, and also Salmonella typhi as well as Staphylococci bacteria. Similarly, certain diseases are called by worms like Giardiasis, filariasis. Filarial worm is there which causes the disease called filariasis. The other name is elephantiasis. Why it is called elephantiasis? Because here the lower limbs or the foot, the leg, it swells just like an elephant, giving the appearance of elephant's foot. So it is called elephantiasis. Similarly, fungal diseases like red rashes, allergy, lesions, dandruff, etc. So you can see the picture of filarial worm and a fungal pathogen causing infection. Similarly, Trypanosoma, that's a protozoa causing the disease Kala-Azar, and another is malaria. It is caused by Plasmodium. So students, you know, there should be knowledge of different categories of infectious agents. Why? Because it's important in deciding the kind of treatment. Because for every microbe, same type of medicine is not given. So we should know which is the infecting agent. And another thing, same drug will not work against a microbe belonging to a different group. That means suppose there is a fungal infection and there is a bacterial infection. So you cannot take the same medicine or the same drug. And you see bacteria and fungi, they belong to different groups. Similarly, bacteria and virus, they also belong to different groups. The same medicine you cannot use for bacterial infection as well as for viral infection. So, before going to the mode of action of the different drugs, we must know what are antibiotics. Because you know, number of diseases, severe diseases are also cured by use of antibiotics. So the term antibiotics is derived from two words, anti plus bios. Anti means against, bios means life, against life. So against whose life? It is against the life of those disease causing pathogens. Got it? Now you see how actually antibiotics are prepared. Now I will be talking about one antibiotic for bacterial infection. Suppose streptomycin. That's the name of the antibiotic. It is used against the bacterial infection caused by which bacteria? Streptococcus. So here certain things we have to take into consideration. What are those? We have to identify some essential biochemical life processes which is peculiar, means which is unique to that group and not shared with any other groups. These processes may be pathogens and for symptoms for new diseases. So we have to find a drug that kills bacterial cell wall synthesis pathway. Means, you know, the cell wall is an essential part required for the survival of the bacteria. Suppose we are making an antibiotic, means medicine, we have to try that antibiotic will inhibit, will stop the formation or synthesis of cell wall of bacteria. Right? So if the cell wall is not synthesized, how the bacteria will survive? The bacteria will automatically killed. Got it? So we have to find a drug that kills the bacterial cell wall synthesis pathway. Pathway means mechanism, without affecting our own body. So we have to kill the cell wall of bacteria. Got it? It should not interfere with our body processes or our metabolic activities. So this is how we have to prepare a antibiotic. But while preparing a antiviral drug, what precaution we have to take? Again the same way, we have to see that that drug will act on the virus and not against our body. But the problem is what? The problem is viruses, they use our DNA, they use our biosynthetic machinery for their growth and multiplication. Okay, so we have to be very cautious while preparing antiviral drugs. What precaution we can take while making antiviral drugs? We have to choose some specific pathways, right, of the virus, so that pathway is unique to the virus and not common to our pathway. Why I am telling so? Because in the beginning I told viruses use our biochemical pathways, our biochemical machinery, our DNA for their metabolic activities. So we have to choose certain metabolic activities. Viruses have some unique metabolic pathways of their own, that we have to choose. And then we have to prepare certain drugs which will act against that specific pathway which is unique to virus and which is not shared with our body. Understood? So definitely the making of antiviral drugs is difficult compared to the making of antibacterial drugs, because bacteria use their own DNA. Okay, so there is no difficulty in preparing antibacterial drugs. But when preparing antiviral drugs, it is difficult because we have to choose only those specific pathways which are unique to virus and not shared with us. So I hope you have understood the mechanism of action of antibiotics and how the antibiotics are prepared. So by this time already we have covered the different types of diseases, then the infecting agents, and how the antibiotics are prepared. So antibiotics are always, they are prepared from one group of microbe and are used against another group of microbes. So here suppose Penicillium notatum, it's a fungus. Okay, from that fungus penicillin, the antibiotic is prepared, but penicillin will kill bacteria. So penicillin is an antibiotic which can kill bacteria. So whatever is taught to you, I hope all have understood. So let's test ourselves, and it is quiz time. The first question: when is a person said to be healthy? So all of you know the answer. It is, a person is said to be healthy when there is physical, mental and social well-being and not merely absence of any disease. Then the next question: which bacteria is responsible for causing the disease typhoid? Yes, the answer is Salmonella typhi. Because I told you, while taking contaminated food, that bacteria may enter into your body and may cause the disease, that is typhoid. Which of the following has a long-term effect on our health? Chronic disease or acute disease? So I hope all can answer the question. The answer is obviously chronic disease, because it is having long-term effect. It may affect our major organs and organ systems. Name the microbe that does not have its own biochemical mechanisms but depends upon that of the host cell. Just now we have discussed. Yes, the answer is virus, because it does not has, it is not using its own DNA, it is using our DNA. So our own biochemical mechanism they are using. So they are dependent upon our DNA or the DNA of the host cell which they enter. Then the last question, what are the 5 F's for preventing transmission of diseases through sanitation and hygiene? Now it is COVID time. All of you know, every day we are practicing it in our life regarding washing of hands. So what are those 5 F's? The answer is fingers. Number 1, fingers. Number 2, filled. Number 3, food. Number 4, flies. Number 5, fluids. So students, I hope all have understood the concepts what are taught today in today's class. So I hope that now you are able to enlist the names of different groups of pathogens, and also you are able to find the difference between acute and chronic diseases, and also you must have developed the ability to analyze the various causes of a disease, and also you can evaluate the mode of action of antibiotics. Just now we have discussed how the antibiotics they act in our body, in what way we should take precautions while preparing the antibiotics, and at the end the most important thing is that you have developed the ability to create mind map so that you can represent the classification of pathogens and the type of diseases. That mind map also you can create now because you have studied the different classification of pathogens as well as the different types of diseases. So that's all for today's class. Thank you.